active vitamin D here. I also want you to meet my parathyroid hormone, okay? You see that? I also want you to meet my calcitonin hormone, okay? And of course, my skin, my intestine, my kidney, and our phosphorus, serum phosphorus, as well as our serum calcium, and our beautiful sunshine. So you see bone, like 60% of bone is made up of minerals. That's calcium, hydroxyapatite, and others, phosphorus, trace elements, okay? And then 40% of it is made up of organic part, like type 1 collagen and matrix and others, okay? So, calcium, let me talk about this pretty calcium. 99% of it, more than 99%, is found in bone in the body, okay? Apart from that, important function of calcium is, of course, muscle and nerve function and clotting mechanism, okay? How do we get calcium into our body? We absorb it in the intestine. And how does it get into blood? It's actively transported in the duodenum, okay? And then there's passive diffusion also in the jejunum, okay? So, let us talk about vitamin D. You must know this. So, vitamin D, how do we come up with the active vitamin D? First of all, it's our skin. The sun shines on our skin. The UV radiation converts vitamin D1 in our skin to vitamin D2. Then the vitamin D2 will travel all the way to our liver. When it gets to the liver, it gets converted by 25 hydroxylase into 25 hydroxycholacalciferol, okay? And then from the liver, it will go all the way to our kidney. When it reaches our kidney, okay, the proximal part, the proximal tubule of the kidney, it will be converted to 125 dihydroxycholacalciferol, okay? And that is now active vitamin D produced in the proximal tubules of the kidney, okay? What are the factors that stimulate production of active vitamin D? Number one is our parathyroid hormone. Parathyroid hormone, high levels, will stimulate production of active vitamin D. Our pretty serum calcium, when it is low in blood, this low serum calcium, that will stimulate production of active vitamin D. And also low phosphate. When there's low serum phosphate, that will stimulate production of active vitamin D, okay? What are the factors that inhibit production of active vitamin D? What are the factors that inhibit production of active vitamin D? Low levels of parathyroid hormone. Low levels of parathyroid hormone will inhibit production of active vitamin D. High levels of serum calcium. When there is increased serum calcium, that will inhibit production of active vitamin D. Serum phosphate. When there is high serum phosphate, that will inhibit production of active vitamin D. What does active vitamin D do? It goes to the intestine and does two important things. Absorption of serum and calcium, okay? Absorption of these two things, serum and calcium, in the intestine. It also goes to the bone. What does it do? Osteoclastic resorption. And what will be the net effect of all those? There will be increased serum levels of calcium and phosphate, okay? Okay. Parathyroid hormone, it is produced by the chief cells of the parathyroid glands, okay? What are the factors that stimulate production of parathyroid gland? It's less serum calcium, okay? When there's less serum calcium, we're going to produce our parathyroid hormone, okay? What are the factors that inhibit production of parathyroid glands? What are the factors that inhibit production of parathyroid gland? We have elevated vitamin D, okay? Elevated active vitamin D will inhibit production of parathyroid gland, okay? And also, serum calcium. When there's a load, increased serum calcium, that will inhibit production of parathyroid gland. So what does parathyroid hormone do? It goes to the kidney. In the kidney, it excretes phosphates, okay? But reabsorbs what? Calcium, okay? Reabsorbs calcium, excretes phosphate, okay? And also, very important, parathyroid hormone will stimulate conversion of 25 hydroxycalciferol to 125 hydroxycalciferol. So there will be production of active vitamin D. Sour. And then the net effect. What will be the net effect? It will be increased serum calcium, okay? And decreased serum phosphate because we excreted it in the kidney, okay? Another that I've not mentioned is in the bones. The parathyroid hormone in the bones will cause osteoclastic resorption, okay? Because we try to elevate the serum calcium, okay? Good. And then our last hormone here, calcitonin. So assuming calcitonin is our girl here, when there are so many girls, like there is a lot of serum calcium, that will mean that a lot of calcitonin will have to be produced, okay? That is our lotion for the girls. So we'll have high production of calcitonin when there's high serum calcium, okay? And the opposite, when there's low serum calcium, there'll be less production of calcitonin. And what does calcitonin do? It goes to the bone and inhibits osteoclastic resorption, okay? And the net effect will be reduced serum calcium, okay? So there'll be less serum calcium. Good.